Well, welcome everyone, and thank you for joining us today. The discussion today is recognizing urinary tract disease in this time of COVID. Our presenter today is Dr. Jody Lulich, DVM PhD DACVIM. Dr. Lulich received his DVM from the University of Minnesota, where he also did his PhD internship in small animal rotating internship, and also did his residency in internal medicine. He is the co-director of the Minnesota Urolith Center at the University of Minnesota and a professor in veterinary clinical science there. Dr. Lulich is an expert in small animal nephrology and urology, or kidney and urinary tract health. He is specifically interested in disease biomarkers research and the crystal lattice microstructure of uroliths, or animal urinary stones. He has received many awards, among them Speaker of the Year at the NAVC North American Conference and the World Small Animal Veterinary Association Award for Excellence in Veterinary Healthcare. We welcome Dr. Lulich.
Hi, everyone. I'm glad you're sharing your lunch with me today. What I'd like to do is just help you through this. So I'm going to hopefully make you self-sufficient. Let's go ahead and get started. So taking your pet to the vet has created new challenges today. I mean, we're always asking ourselves, is it safe? Is it necessary? Or can we wait? And then with our masks on and not being able to see the clinician, we have to ask, how do I best communicate what's going on? So those are things that I'm going to go through today. I will share several tips to make this pandemic easier to navigate, and also to make our pets healthier. Now, it's important to realize that although we're talking about it in the face of COVID, these tips are good for you to continue even when we return to our normal. Now, you need to know what's common, and the reason why is because sometimes we're going to be faced to treat disease in the face of uncertainty, right? So let's talk about what things that are common, because those are the things that we can treat, hopefully, much more confidently. So when it comes to the dog, there are 3 diseases that are common in the dog: bladder stones, urinary incontinence, and urinary tract infection. And now there are differences in gender and age. Male dogs rarely get a urinary tract infection, where female dogs do. So trying an antibiotic in a female dog is a good thing to do. There's also some things with age. Urinary incontinence is more common in older dogs, and so is cancer. And bladder stones are actually more common in male dogs than they are in female dogs. Let's take a look at the diseases that affect cats. When it comes to cats, idiopathic cystitis is the most common disease. The good news is for about 90 or 85% of our patients, it goes away in about a week, even if we don't do any therapy. In terms of things that you really need to worry about, however, is urethral obstruction. That's a life-threatening disease. You definitely need to go to see your veterinarian or go to the emergency clinic. Now, this is where cats are different from dogs. They rarely have a urinary tract infection. So if I'm looking for a treatment for the cat, I'm not going to choose antibiotics as my first treatment. So now you know the diseases that are common. Let's go ahead and look at some of the things that you need. So what supplies do you need at home to help your veterinarian and to also help your pet? Now, it's really simple. Some of these things you already have already, and some of these other things you can get online. So I'm going to say you need a smartphone. If you have a dog, you need a ladle to collect some urine. One of the easiest things to do is you can look at urinary tract disease by buying urine reagent strips online, dipping them in urine, and looking for abnormalities. Some of the things to keep you clean is that if you have these disposable pipettes or small tubes, then you can put the urine in that and collect the urine with these pipettes instead of trying to pour it into other containers. And lastly, I'm going to say that you need a motion activated camera. I know some of you may not have these things, but I'm going to show you how to use it. Let's get started with a few things just so that you get a good idea. I'm going to say that most important thing is still going to be your cell phone, because I want you to take a picture of the animal in action. I want you to take a picture of what the urine looks like, because I want to know, where this patient is urinating and also the volume of the urine. So we're going to start with a few movies. Here we go right here. Tell me what you think is going on with this dog. So looking at it, you already see that the urine looks red.
That bloody urine.
It's bloody urine, you're right. Well, the good thing is when you look at this dog, you see that he doesn't have any urgency or anything, right? So that tells me that this urine is probably not showing up from a problem in the bladder or the urethra. It's probably a problem in the kidney, or maybe something wrong with your dog's red blood cells. So that's why it's important that if you get that movie, I can better understand what's going on with your patient. Let's look at another one. This is a bulldog. This owner is concerned because this dog in the past has had urinary tract infections. And now when the owner walks this dog, this dog urinates very frequently. So let's go ahead and look at this dog. So you can see right away what this dog is doing. It's a female dog, is she's smelling the ground there. And then what this dog is doing is you're going to see this dog is going to smell the ground, and then it's going to urinate right where it's smelling. So I'm going to ask this owner a few more questions. I'm going to ask the owner if this dog is having any accidents in the house, and if the dog gets the owner up in the middle of the night to go out to pee. And the owner told me no. So you know what I'm going to tell my owner is, don't worry about it. Your dog is urine marking. It has nothing to do with a urinary tract problem. That's normal behavior in your dog. Let's look at one other case that I videotaped. So here's a dog that I videotaped to show the owner. You can see this dog is straining to urinate, but really nothing is coming out. This is a male dog, so you see the end of the penis. He's straining really hard, and it's taking him a long time. So this is an emergency. You want to bring your dog to the veterinary clinic that day, not the next day, or if your vet says that you should wait, you need to send this video so your veterinarian knows that it should not wait. This is really an emergency. So this is where that cell phone is going to really be very important in terms of making that diagnosis quickly and letting my clients know whether or not they should come and see me. Now what we're going to do is we're going to talk about blood in the urine, or hematuria. Now the wonderful thing is I live in a geography where it snows. I don't want to say half of the year, but at least, 1/3 of the year. And it's interesting because whenever we have our first snow in Minnesota, we get a lot of calls because the owners finally notice blood in the urine where they didn't notice it before. What you need to know about blood in the urine is that it's one of the most common abnormalities when disease is present. The other thing you need to know about blood in the urine is sometimes it's visible and sometimes it's not. All of these samples that you see before you have blood in them. In 2 of them, it's obvious, the 2 on the bottom. In the others, blood was not detected until it was tested. So how do we test the urine for blood? And this is what I'm going to get you to do. What you'd like to do is use one of these dipsticks. The wonderful thing about this procedure is it's the same thing your lab would use. It's the same thing that your doctor, if you went to the doctor, would use. And the wonderful thing is you can get 100 of these strips online for somewhere between $10 and $20. So you can really become your own diagnostician and help your pet, help your veterinarian, and ease some of your concern. Let me share with you what's good about this and some things that you can use and some things that you shouldn't. Now, what I'm going to have you pay attention to is the blood on the stick. And as long as you're not colorblind, and me being a male, there are a lot of males out there who are colorblind. So you may have a hard time and you're going to need some help from your neighbor or your wife or your daughter just to make sure that you're seeing things okay. But all you need to do is dip the stick into the urine and then look at it in about 60 seconds. Now, there's a lot of information here, so I'm going to share with you some things that you should not look at because they're not reliable. These strips are made for people, and in dogs and cats, you may get some falsely positive results. So at the top there, you're not going to look for leukocytes, which is another name for white blood cells. It's not going to help you. You're not going to look for nitrate. In fact, they're usually positive in all of the cats, so you're going to be giving your cat a disease when it doesn't have a disease. And the other thing you don't want to do is look at urine-specific gravity, which is the concentration of the urine. Because the specific gravity in you and I is much lower than a dog or a cat. So don't look at that because it's not going to tell you the ability for your pet to actually concentrate its urine. Well, now that I've shared with you dipsticks, now what I'm going to do is I'm going to have you pull that soup ladle out of your drawer, because that's what I'm going to have you collect urine. Now, there are many ways you can collect urine. You can just use a clean cup. You can use a soup ladle. If you're really cheap, you can buy one at Goodwill for $1. But like my household, we have several. We can certainly take one out and just use your permanent marker and put on there for the dog, so that you don't use it for dishing soup out anymore. What you want to do is you want to take time to do it. I mean, it does require some practice. It requires you to know when your dog is urinating, that you're not trying to do something unusual. It's important that you go ahead and it's important that you go ahead and little bit. The other thing you need to know is you don't need all the urine. You just need a teaspoon of urine. And if you, likely your dog's going to step in it before you get a good sample. So now that you need, and also what you how you
Dr.
do now
Lulich,
is,
Dr.
yes.
Lulich, you're breaking up a little.
Okay, so I'll slow down. I am at my internet connection is still okay. How am I doing now? Am I doing okay?
That is much better now.
Off and on. So what I'm going to do now is go through some applications. And each one I'm going to have a question. And so this first one right here is we're going to say, did bladder stones recur or not? Know about me is I developed this wonderful technique about 20 years ago to remove stones non-surgically. What I do is I anesthetize the dog, you and I, and express the dog's bladder. That looks like. What you're seeing is the dog to your right for me to collect urine. Here we go. Now express the dog's bladder. You can see come out in the cup. So it's a really easy thing to do, but stones need to be small in order for me to do this. Let me show you the size of the stones and the number of stones that I collected. So this is wonderful because I can remove small stones in seconds that would take a surgeon about 45 minutes. The important thing to realize, however, is I can only remove them when they're small. And these look like calcium oxalate stones, so they're likely to recur. So what I have owners do is come back and visit me every 6 to 12 months and we do an x-ray. Because if I catch them when they're small, the price is lower, the anesthesia duration is lower, and animals go home the same day. So owners get worried, so they do come and see me. Well, now in this time of COVID, they can't come and see me very often, right? The number of patients I see is less. So what I'm going to tell them to do is, I know you want to come and see me, but what we need to do is check to see if there's blood in your dog's urine. Because if there's blood in your dog's urine, you probably do need to come and see me because I want to remove these stones when they're small. Let me show you how to check. So I showed you about the dipsticks. I showed you how to collect urine. What you're going to do is you're going to take that little dipstick and dip it all the way down in the urine. After you do that, you're going to pull it out, and then you're going to go ahead and blot the dipstick on the side. Now, the reason why you're going to do this is because you don't want the different colors between the pads to mix. And by doing that, then you minimize any excess urine. Then what you want to do is place the pad on your little, place the dipstick on your pad and just let it sit there for about 60 seconds. And that's when you want to read it. And the way you read it is you look at the chart on this little container here. You just look at that chart and match the pad with the chemical that you're going to look at. So we're going to look at blood, and you can see that I don't see any blood there. So that's really good if you're good at collecting urine. But most of us neophytes aren't going to be good at collecting urine, and so you're only going to get a small amount. So this is what I'm going to ask you to do. Cut that dipstick pad at the level of the blood, because all I want you to do is look at the blood. And so when you cut it, then you have a shorter pad. And the reason why that's important is because when you go collect that urine in that ladle, you can see that you've only collected a small amount. Then you can just dip that dipstick in that small amount of urine. Again, go ahead and blot it so that you can minimize any excess urine draining from any of the other pads that may change the color. You're going to let it sit there for 60 seconds, and then you're going to go ahead and look and compare again. So what I can see from my dog is that there's no blood in the urine. So what I'm going to tell my patient is that, you know, I need to see some of my patients that are in dire need first. So don't give up on this. Why don't you repeat this test in a month? Or why don't we just go set you up for an appointment in about 2 or 3 months, and we'll get you on the schedule, and we'll make sure that we get you in then. But you don't need to come in right away. You can keep yourself safe, and your dog should still be a good candidate for me to remove those stones non-surgically. So that's our first case. Let's go ahead and look at our second case. Here's the next one. Which animal is peeing in the house? So this is going to be really important. And you know what I'm going to do is I'm going to use my own animals as an example. Now I actually have 3 animals. I have 2 dogs and a cat. So here are my 2 dogs. I have this long-haired Chihuahua, who's a stone former. I have this Yorkshire Terrier, who's a stone former, and I have a cat. You can see her with her head on the bottom coming up in there. Now, what you don't realize is my dogs are urinating in the basement at night, and I don't know who's doing it. I really think it's the cat, because you know how cats are. They just tend to urinate in abnormal spots. In order to solve this problem, this is where I'm going to have you get that motion activated night sensing camera, because that's really going to be good. What I'm going to do is I'm going to go ahead and set up that camera where I see the urine puddle every morning, or not every morning. It happens about once a week. So I'm just going to set this camera down, and then I'm going to go and inspect it every morning. And when I inspect it, this is what I end up seeing. It's not the cat at all. It's the Chihuahua, who actually sleeps in bed with us. So the Chihuahua jumps out of bed, goes downstairs, pees in the bed, and then, or pees on the rug in the downstairs office, and then jumps back in bed. Well, my dog is actually pretty old. I did go ahead and evaluate my dog for urinary tract disease. There wasn't any noticed. So what I end up doing is putting a diaper on my dog. It really saved a lot of problems and a lot of cleaning up. Now, this is really good too, because if you have a sick animal, if you have more than one animal in the house and you don't know who's urinating on the rug or on the bed or those other things, you know actually which animal to bring to the veterinarian, as opposed to us hunting. Because remember, this is a time when you want to minimize your visits to the veterinarian. Let's go ahead and look at another case. Another inappropriate urination. So application here is the inappropriate urination behavioral or medical? And that'll be important because I'm not a behaviorist. And if I want to get your animal to the right spot, we need to have an idea in the beginning, really what's going on and who's actually causing the problem. Let's look at our case. ML is a 7-year-old female spayed domestic short-haired cat who's urinating on the couch. And so what I want to know, is it behavioral or is it medical? Because then I'll know what to do and give you some advice. As I mentioned before, blood is a common laboratory abnormality that's easy for you to detect, that happens with most medical conditions. Not all of them, but it does happen with most of them. When you have behavioral disease, it's actually less likely to have blood in the urine. And so what you're going to see is no blood in the urine. But as I mentioned before, you may not always see blood. Sometimes it's microscopic, or it's in such small amounts that you're going to have to use other methods to detect it. Now, when it comes to the cat, I'm going to say that you should do something different from a dipstick. What you can do is you can buy these blue care granules. And what I'd like you to do is just go ahead and put the granules in the litter pan. And then what I'd like you to do is evaluate them after your cat urinates. So you put them in the litter pan, and if you look on the bottom there, after your cat urinates, if there's no blood in them, they're going to stay their normal color. But if there is blood in them, it's going to change to blue. And so that's going to be an important thing to actually do. Now, if you live in a multiple cat household, what you want to do again is use that motion activated camera so you know who's actually urinating when those pellets turn blue. And then you'll actually be able to know which cat as well. Now, this is really important for you to do even in times of not having COVID. And here's the reason why. As a veterinarian, most of the time we're going to collect the urine by cystocentesis or catheterization. And what you need to know is cystocentesis and catheterization can cause blood in the urine. And so we'll end up with these false positives, and we may end up spending more of your money looking for stones or an infection or cancer. But this way it'll tell us more because you've actually collected urine without us incorporating these techniques. So this is a really good test for you to do. Well, there are other ways for you to collect urine as well. I've already mentioned about the urine camera. Or the camera for the motion activated camera, but there's actually hydrophobic litter. Now, I don't often recommend this for cats very often, especially if you think they have a behavioral problem, because changing the litter may actually compound or make that behavioral problem worse. If you don't think you have a behavioral problem, you can go ahead and use the hydrophobic litter and then just go ahead and scoop it up and not scoop it up, but actually draw up that little urine and test it on those dipsticks. So that would be one thing for you to use. But again, oftentimes with my cat owning people, I tell them don't go changing the litter because it may change the urination habits of your cat. Let's go ahead and look at our next case now. So what we're going to do here is we're going to ask, is the blood coming from the bladder, the vagina, or the rectum? You may be wondering why I'm asking that question. I'm going to show you another video. Now this right here is Casey. Casey is a 13-year-old Cocker Spaniel mixed dog who's coming to see me because the owner noticed blood in the urine during the winter. Here you can see this dog urinating, and when the dog gets up, this is what I noticed. So I told the owner, this is quite unusual. It looks like one part of the urine I don't see any blood, and the other part I'm seeing blood. So it made me ask a few questions, meaning, is the blood coming from the vulva or the vagina? So then I need to do something different, right? I need to go ahead and maybe do a digital exam of the vagina with the dog sedated or anesthetized. And that's really important because most ultrasound is not going to tell me anything about the vagina. And if it's a soft tissue mass, an X-ray won't help either. The other thing I want to know is it coming from the rectum? So what I'm going to have her do is actually take a picture of the stool as well, because if I see blood like that, I should see it on the stool in addition. So what I'm going to do for this owner is I'm going to say, you know, before you come and see me, what I'd like you to do is go ahead and get a ladle and collect urine, and I'm going to have you do a midstream collection. Now this midstream is really important, I tell them, because the initial stream or the end of the stream will tell me something different. Most of the midstream urination is coming from the bladder. And so again, it's going to require a little bit of practice. And with a female dog, sometimes they urinate lower than a male dog. So take your time to practice in your urine collection. So then she does that, and I tell her again, just go ahead and cut the little strip off of the urine strips. And then here's the strip before, and here's the strip after. So you can see that there is blood in the urine. So that tells me a lot. When I see blood like that, it either tells me that it's at the very beginning of urination or at the end of urination. And when you have disease at the end of urination, it's either at the front part of the bladder, or when you have blood in the urine in the beginning of urination, it's generally the urethra. So it tells me a lot to do. So what I'm going to do is I'm going to set up an ultrasound. So in this time of COVID, I need to know that when my dog comes in, I need to have an ultrasound available. So when I do an ultrasound, what you're seeing here is a picture of the bladder. Here's the front part of the bladder, and here's the back part of the bladder. And you can see that there is a mass there as well. And when I do the ultrasound, I also see that there's tissue expansion in the urethra in addition. So I don't have good news to tell this owner, but at least I set up the right test. So in this time of COVID, I knew that I had to do more than just a urine culture or urinalysis. I needed to know that I needed to do some additional diagnostics. So I needed to know that I needed to set up ultrasound. So it was important that the owner helps me in terms of making this decision. So they were very instrumental in setting up this appointment so that we got things done quickly and efficiently for her patient. Unfortunately, the news wasn't very good. It did turn out to be cancer, but we did make the diagnosis right away. Let's look at another case. This is application 5. And for this application, I'm going to have you use that dipstick a little bit more extensively. And we're going to ask the question, is it diabetes or is it kidney failure? Now, the reason why the owner called me to set up an appointment is because her cat is urinating more frequently. Changes in urine volume are often associated with many diseases, but the two most common are going to be diabetes or kidney failure. There are some other diseases as well, but those are the top ones on my list. Telling the difference between these diseases is easy. Let me show you how it's done. One of the most important things we're going to do is we're going to look at urine volume. Let's start with the cat first. And I'm going to recommend you do this for every annual exam for your cat. What you ought to do is you ought to take a picture of the litter pan and bring it in for your annual exam, because then your veterinarian can tell whether or not your cat's urine volume is increasing. This is sort of normal. Remember to take a picture of a coin, like a quarter, near the urine spot that your cat is urinating. And if you're in a multiple cat household, remember to incorporate that motion activated camera, because then you can tell me which cat is which. And then you can put the cat's name on the sample when you bring it in. So here's a urine sample from a cat where it's too much. This is polyuria. So it tells me, especially for cats, that we can look at disease early. So we're going to start looking at disease early. Now let's apply what I've shown you to a case. TC is a 12-year-old male-neutered domestic short-haired cat with increased urine volume. As I mentioned before, there's only a few things that cause polyuria. It's mostly going to be glucose or kidney failure, and the other things are much smaller, so you don't have to worry about it. Now, the wonderful thing is what I'm going to show you is on that urine dipstick, what you can actually do is monitor for glucose. So it's usually that pad way at the front there. That's what's usually associated with glucose, and it's going to change color depending upon how much sugar is actually in the urine. Now, I'm going to have you do something a little bit different for this cat. Remember how I had you cut the urine dipstick to make it easier to look for blood? What I'm going to have you do is I'm going to have you cut the urine dipsticks so that you have little things to put in the urine. So it's usually, again, very at the end. And what you can see here is I'm cutting about 10 of those little dipsticks. And don't worry, it's really very inexpensive. Remember, a whole 100 pads are going to cost you about $10 to $20. Believe it or not, if I run a whole urinalysis in my hospital, it's going to cost somewhere between about $50 and $70. So it's really good to do that. Then what I'm going to have you do is strategically place those little pads around the pad or in the litter pan there. And the other thing I'm going to do is I'm going to have you again pull out your camera for two reasons. If you live in a multi-household cat, if you have a household with many cats, you can go ahead and make sure that you're really monitoring the cat that you think has increased urine volume. The other things are these cameras are wonderful. Not only will it take a picture or a movie of the cat and tell you which cat, you can also program them to your smartphone to tell you when the cat urinates. So that's really good, so you can go and collect them and read the pad right away. So here are our results. When our cat urinated, you can see that the little strips turned brown. So that tells me that it's more than likely that our cat has diabetes and needs to come and see the veterinarian. The good news is catching this disease early can save you lots of money. I mean, you may catch it when the cat is very sick and may need to spend several nights in our hospital. But if you catch it early, monitoring is much easier. Your cat doesn't have to spend in the night in our hospital, and it's less expensive. So those are really good things for you to think about if your cat is urinating more. And it's important to realize that early in the phase of diabetes, your cat may appear very healthy. In fact, your cat's appetite may even increase, so you don't think that there's a disease going on. So that's why it's important for you to monitor at home. And this is just what it looks like. Now, dogs are a little bit different. They don't urinate in a litter pan. You can buy a refractometer. So if you're really good at looking at urine, this is your next level. You can buy a refractometer. Believe it or not, they're only between $20 and $30. Buy a veterinary one, because they also have refractometers for those people who make craft beer. You don't want to get that one. It's really different. This example shows you how to read it.
I'm not sure I understand.
And so you can go ahead and do that as well. Well, these are the cases I wanted to share with you today. Let's summarize some of the things we've gone through. In the time of COVID, I want to keep yourself safe and to keep your animals healthy. I've introduced you with a few tips that may be helpful. So here are some of the tips. If you recognize urinary obstruction, it's an emergency. You need to go in and see your veterinarian. To communicate effectively, you want to start videotaping your pet in action. Not only your pet, but the stain and the size of the urine puddle. And the other thing you can do is you can begin to monitor for hematuria. It's a common sign for urinary tract disease. And believe it or not, you can do it more reliably than what I can do at home. So if you follow these healthy tips during your next visit to the vet, you should be saving money, saving time, keeping yourself safe, and really you're going to achieve a better diagnosis.